If a C-section becomes likely, here's a sentence that protects your peace immediately. Can you tell me what you're seeing and what you recommend? Not because you're being difficult, because you deserve to understand what's happening to your body. If you're a first-time mom in the US and you're pregnant right now thinking, I really want a calm birth, but what if I end up with a C-section? This video is for you. In the next few minutes, I'm going to give you 7 questions you can ask before and during a C-section so you feel informed, supported, and in control, even if the plan changes. And stay with me because question number 5 is the one that stops a lot of moms from being blindsided afterward. Hi, I'm Cherry, a certified maternal and newborn nurse, and I'm here to help you heal physically, feel emotionally seen, and rebuild your strength during the 4th trimester. You ready? Let's get into it. First, a C-section happens when the safest plan changes. Sometimes slowly, sometimes quickly. And what makes it feel traumatic for many moms isn't the fact that it happened. It's that they felt decisions were happening around them rather than with them. So the goal of this video is simple. Give your words you can actually use when your brain is tired and emotions are high. I'm going to go through the 7 questions and I'll tell you exactly why each one matters. Before I start the list, here's the mindset I want you to carry. You can be calm and still ask questions. You can be respectful and still advocate for yourself. That is informed consent. Okay? Here we go. Question number 1. What are you seeing that makes C-section the recommendation right now? This question keeps everything grounded in facts instead of fear. Sometimes the reason is that the baby isn't tolerating labor well. Sometimes labor is not progressing safely. Sometimes it's a position. Sometimes it's something urgent. Whatever it is, you have the right to hear it plainly. Not in confusing medical language. Not in hints. Plain. And if they answer too quickly or too vaguely, you can follow up with, what is the risk if we keep going the same way? That's how you understand the why. Question number 2. Is this urgent or do we have a few minutes to prepare? This question changes the emotional tone entirely because not every C-section is a crash emergency. Some are time sensitive, yes. Some are urgent. Some are planned. And if you have even a few minutes, you can use that time to breathe, ask for support, and mentally shift gears. If it is urgent, you can still ask one short question. What is the most important thing happening right now? You don't need a speech. You need clarity. Question number 3. What happens next, step by step, from here to the operating room? This is one of the most calming questions because uncertainty is what makes your brain spiral. A step-by-step explanation helps you feel like you're participating, not just being moved. Here's what a simple explanation might include. Who comes into the room, whether your partner can be with you, what you'll feel, what you might hear, and what happens right after the baby is born. Even a quick overview reduces fear. Quick note before we keep going. If you want this laid out step by step so you're not piecing it together when you're tired, my Strong Start C-section recovery kit is linked below. It's the exact recovery roadmap I'd want for my own family. Now, let's get back to the questions because this next one is what stops a lot of panic in the OR. Question 4. What can I expect to feel and what should I tell you right away? A lot of moms are surprised by pressure, tugging, shaking, nausea, or feeling short of breath from the numbness moving upward. That doesn't automatically mean something is wrong, but you should know what's common so you don't panic. And you should also know what you should report immediately. This question gives you a clear boundary between normal sensations and I need help right now. Question 5. What can we do to protect bonding right away? Skin to skin, photos, delayed cord clamping. This is a question that prevents regret for many moms because afterward they'll say, didn't even know I could ask. Now, sometimes certain things can't happen depending on how the baby is doing. Safety comes first. But when the baby is stable, a lot can still be done to protect the emotional experience. A quick check, and then the baby brought to your chest, your partner doing skin to skin, photos, talking you through the moment instead of silence. If your preference is skin to skin, say it. If your preference is that your partner stay by your head and narrate what's happening, say it. Those are reasonable asks. Question 6. What is a pain plan for the first 24 hours? And how do I stay ahead of pain at home? This question matters because pain control isn't about being strong. It's about being able to move, breathe deeply, walk, and care for your baby without suffering. You'll want to know what medications will be used in the hospital, how often, and what the plan is once you're discharged. If you're breastfeeding, you also want reassurance about what's compatible, and you want to know how to avoid the common mistake, waiting until pain is out of control and then trying to catch up. If you want a simple phrase to use, say, I want to stay ahead of pain so I can move safely and care for my baby. Question number 7. What are the top 3 things I need to watch out for after I go home? This one is about safety and peace of mind. When you're home, you don't have a call light, so you want clear guidance on what's normal and what needs a phone call. A good answer usually includes fever, worsening redness or drainage at the incision, heavy bleeding, severe headache, chest pain, shortness of breath, one-sided leg swelling, pain that suddenly gets much worse rather than slowly improving. Your provider may add specifics based on your health. You want personalized guidance, not vague reassurance. Now, let me add something that matters just as much as these questions. Who is in the room with you? If you have a partner or support person, you can give them a job. Tell them, if I get quiet or overwhelmed, you ask the questions. That is teamwork. And here's the most important emotional truth I can leave you with. If your plan changes and you end up with a C-section, you're allowed to feel 2 things at once. You can feel grateful that you and the baby are safe, and also feel sad that it didn't go the way you pictured. Both can be true. Your feelings don't have to be logical to be real. If this helped, subscribe. I'm going to keep this content clear and honest, so you don't have to piece your birth education together from random clips online. Here's to an empowered birth, one where you feel informed, supported, and respected. I'm Cherry, and I will see you in the next one.